At the OECD, we have calculated that tackling harmful related alcohol require an effective and efficient package of intervention. We call this package of intervention the 4 Ps. 4 Ps because the 4 policies that best tackle this issue are physician, police, promotion, and price. Let's start from the first, physician. We saw that less than 10% of people addicted to alcohol that have a harmful consumption of alcohol in the OECD are identified and treated by our healthcare system. Better explaining to physicians what are the harms connected to alcohol and giving them incentive to identify and treat these persons is one of the policies. The second one is police. Much of the burden caused by alcohol is associated with conditions like injuries, violence, better enforcement of policies and action to identify, for example, drink driving and decreasing violence in the areas where alcohol consumption is high, again, would have a tremendous impact on the health and economy of a country. Promotion. Alcohol industry is increasingly using sophisticated approaches to find new ways of advertising and promoting alcohol, particularly to specific population groups, for example, youngsters or women. A regulation of promotion, and Finland is currently one of the most effective policies in the OECD area to tackle advertisement, is one of the interventions to put in place. The last one is price. Regulation of price, in particular, making sure that affordability of alcohol doesn't increase over time, would keep away from alcohol, would decrease alcohol consumption, and in particular would decrease the use of very cheap alcohol, which is the one used by addicted person to alcohol. Continuing investing in tackling harmful consumption is positive in terms of health of the population. We calculated at the OECD that in countries like, for example, Finland, 1 year of life could be saved if countries put in place very effective policies to minimize consumption of harmful alcohol. And it also has a positive effect on the economy in terms of reduction of healthcare expenditure, but also increase of the GDP. So our suggestion to countries is to keep investing in this intervention, in effective and efficient intervention. The 4 Ps are the package of intervention that out of our analysis comes as the most efficient approach. But there are other policy actions that could be implemented. In virtually all the OECD countries, there is, for example, some regulation on the access to alcohol, whether it's by age or by location. Again, that's a policy that is effective and efficient, as well as providing more information on the harmful use of alcohol to the population.